Okay, hi everyone, thanks very much for the invite. I'm largely going to talk about green space, green and blue space, and some work that we've been doing since 2010 in Belfast, evaluating what started off as a kind of broad public health impact of a new urban greenway, but very much now looking at it in terms of its kind of human health and planetary health impacts. So, I mean, as we've heard about a lot already today, we know from the IPCC report that there's a real need to urgently scale up and address health and climate crisis to really look after our planet. And one way that governments are embracing is this concept of multi-solvers. So these are really solutions, policies, interventions that can help resolve both our kind of human and planetary health challenges. And we can think of green and blue spaces as a multi-solver, so something that has multiple wins from a policy perspective. And we know our green spaces, such as our greenways, parks, etc., can impact on health in a number of ways, particularly around our physical health, our mental health, but also a range of co-benefits such as social well-being, economic outcomes, and also environmental outcomes that are shown here in the diagram. But we also know that a lot of this research is from cross-sectional evidence, and there's very little from kind of intervention, longitudinal studies. And also these boxes over at the far side in terms of the physical environment and also those environmental outcomes are the evidence base is much less developed. The evidence base is much sparser, and we know very little in terms of how they actually have an impact on health. So we published this paper which demonstrated the role of green and blue spaces contributing across many of the SDGs, the Sustainable Development Goals. And the paper really shows that urban blue spaces can impact across nearly all of these SDGs. And I'm going to talk about three in particular today from some of our work. So good health and well-being, reducing inequalities, and around sustainable cities as well. So I've spent, since 2010, it was actually my first postdoc job, working in terms of the public health impact of the Connswater Community Greenway, which at the time was a new investment from the National Lottery of £35 million to develop a new greenway in East Belfast, a particularly deprived part of Belfast, and very much trying to fill this knowledge gap and evidence gap that we have around the impact of green space interventions from a health perspective, but also that social, economic and environmental aspect as well. So fingers crossed this work. I've got two little short videos just to show the kind of before and after impact of the work.
It would be good for the environment if it was cleaned up. It would be very scenic.
It is a complete mess, and there is such a lot of potential down there.
It used to be an adventure for us, this river, and I would love for the kids to experience the simple and innocent stuff that we did in it as well.
It'll bring the people of the area back together. It will put the heart back in East Belfast.
So that's very much a kind of before shot, particularly kind of deprived area of Belfast, particularly inner East Belfast. The Greenway follows the concourse of three rivers, the Connswater, Knock and Loop River. They needed a lot of restoration, regeneration, and also a very kind of disconnected community as well, both in terms of the community, but also in terms of the different spaces. So this is what, £35 million investment.
I just get out at lunch for a quick walk, and it's great just to get out across to the park. I use it for work every day, and I've only started this summer using it. I think it's great.
The roads are busy, they're dangerous, and this can de-stress you, and it's nice to be in nature.
We just love, we'll come out 2 hours every day for a walk. It's lovely. And it's lovely to see the wildlife and everything, the trees. It's lovely.
Good for the mind, good for everything. Really is.
Just to see the scale of this, to see the quality of it, to see the numbers of people from right across Belfast using this, does my heart a world of good.
So that just kind of hopefully gives you a little snapshot in terms of what some of the changes, both in terms of the investment in infrastructure, the restoration of the rivers, the inclusion of landscaping and biodiversity. But very much at the heart of this, it's called the Connswater Community Greenway, and the community has very much been the heart of this right from the kind of design and development phase. And this slide here just highlights just some of the kind of core elements, I think, that contribute to the success of the Greenway, particularly in terms of the integration of those social programmes, events and engagement that are continuing even today as well. That very much that volunteering's at the heart of it in terms of that management and maintenance and stewardship of the spaces. And the other key element is that the Greenway's open 24/7 and lit 24/7, and it's the only local green space in Belfast that's open and lit 24/7 as well. So I'm not going to go through all of these different elements in detail, but this is just to highlight the kind of range of different methods, data sets, and different kind of angles that we research the Connswater Community Greenway on. I think we're sharing the slides with the QR code and the link there to a protocol paper that gives you much more detail. But a lot of this work has been data collected at baseline, so before any development happened on the Greenway, then kind of immediately, so 6 months after the Greenway was opened, and then we repeated a lot of the data collection in the last year. So it's open now about 5 or 6 years, so we're really starting to understand those long-term benefits. So we have a repeat cross-sectional household survey with 1,200 local residents living within about a 1 mile radius, so about a 15-minute walk from the Greenway. Administrative data where we're looking at medication prescriptions and hospitalisations for different chronic diseases, also birth and maternal health outcomes. Economic evaluation in terms of particularly the health, environment and social economic impacts. And other work trying to understand number of users of the space, who's using the space, and also those mechanisms about how these impacts or unintended consequences are happening. But say more detail in the protocol paper. But let me just touch on a few of our kind of highlights of the research so far. So as well as some of the benefits you heard in the video, we know from our household surveys that we see significant intervention effects in terms of physical activity levels, in terms of mental well-being, in terms of social capital and perceptions of environment. And we also see economic impacts through a social return on investment analysis. And this looked at different domains, so property values, climate change, flood alleviation, health and well-being, tourism, so particularly visitors to the space who live outside the local area, impact on crime, particularly around antisocial behaviour, biodiversity and also employment and productivity. And our findings show that for every £1 invested in the Greenway, there's an expected return of between about £1.34 and £1.56, which equates to about a total present value of around 60 million. Looking at it then, particularly from a climate adaptation lens, so I've just picked out these particular elements that we factored into the social return on investment. So we've £12 million flood alleviation scheme with just over 1,700 properties protected from a 1 in 100 year flooding event. And you'll see the figure there in terms of its present value or per year value. There's 16 kilometres of dedicated walking and cycling infrastructure to promote that modal shift from the car to active travel. And we see just over 700 fewer cars on the road in that Greenway area per day, leading to a modelled reduction of 1% and reduction in air pollution. And then embedded within that is sustainable urban drainage or SUD schemes as well. Just to look at some of the top line figures then in terms of users. So again, this is collected So before the Greenway was built, about 6 months after it was built, and then in the last kind of year, looking at those long-term impacts. This is literally counting people using the space over 7 consecutive days in different seasons and at 4 one-hour time points. So it's using a validated method called SOPARC, which stands for Systems for Observing Play and Recreation in Communities. And these are the different sites along the Greenway then that we collected data on. And the headline finding here is really we see a 140% increase in the number of users from baseline to last year. Our last data collection point was actually in August. And we see an increase of about 11,000 users in the winter period. We have similar figures for the summertime period as well. And we see significant impact for civic squares. So that was a new, you've seen on the video, C.S. Lewis Square. So this was a new kind of civic hub that East Belfast didn't really have before, which went from a derelict space to kind of a real kind of central hub of the local community. This data here is just built using some of our intercept survey data. So again, literally stopping people in these spaces and doing short interviews, why they're using those spaces, where are they coming from, what do they think of the space. I've picked Flora Street because it's a particularly deprived area along the Greenway. And just some top-line findings here. So we see a 60% increase in terms of the numbers of users in this space, over 400% increase in terms of the number of cyclists as well. And you'll see the figure down there near the bottom, just over 50% of the users in this space are for some of our most deprived areas in Belfast. So to give you a little taster just on one of the sites. Just some headline findings then from our household survey. So this is using the Global Physical Activity Questionnaire. Again, repeated cross-sectional survey of 1,200 adults living within a 1 mile radius of the Greenway. And here we see there's a 2% increase in population level physical activity. We also see significant improvements for mental well-being using the Warwick-Edinburgh mental well-being scale, again at population level. And the work we did with administrative data, so this was looking at changes over time of medication prescriptions, particularly around antidepressants and anti-anxiety medications. And then again, we see a significant reduction in medication prescriptions for those living in that defined Greenway area compared to our matched controls, which are in the broader Belfast metropolitan area. So those that live greater than a 1 mile radius from the Greenway, linked through their unique property reference number. We've similar figures for hypertension as well. So as we know, these types of interventions, they're permanent. We rarely actually look at their long-term or measure their long-term impact. So we modelled the cost effectiveness of the Greenway over a 40-year period. And we picked 40 years because this was the length of time that the local city council have agreed to manage and maintain the Greenway as a high-quality space. And the figure here on the left shows the number of new chronic cases prevented over that 40 years, and on the right, the number of deaths prevented from a range of these different chronic conditions. And we model if 2% of the population change from not essentially meeting the physical activity government recommendations to meeting those. So we model 2%, 5%, and 15%. And what we see here is if 2% of the inactive population become physically active and meet those recommendations, then the Greenway essentially pays for itself in terms of the reduced burden on the NHS in terms of new cases or deaths from these chronic conditions. And if you think back a few slides, that 2% is what we're currently seeing in terms of change in population physical activity. But we know that different subgroups of the population experience differential health benefits of green spaces. So we know, for example, women, older people, people with disabilities, people from low-income communities are likely to incur far fewer health benefits because they've either less access to it, or if they do have access, it tends to be of poor quality. And this is just a paper we published earlier this year. This was UK-wide, but the headline here is that for every 1% increase of green space in a particular area, the annual count of preventable deaths among the most deprived neighbourhoods sees a lower number of preventable deaths by between 37 and 41%. And we see in our data, we see more significant intervention impacts for females, for older adults, and for those in most deprived communities as well. We don't just do kind of broad picture public health impact natural experiment evaluation. We're also what we're called responding to challenges. So it's kind of like a living lab. I'm not going to go into these in detail, but if anybody wants to come and chat about any of them, I'm happy to. But I will talk about climate and nature action. So our next phase of work is really looking at the Greenway and how it can support the local community in terms of climate mitigation and adaptation. So thinking about sustainable food, travel, energy, housing, and the economy. This is a report we did based on community consultation a couple of years ago. And it came up essentially with these 7 recommendations. So around eliminating emissions through provision of safe walking and cycling routes. The Greenway has also brought new businesses and housing into the area, so thinking about its role in terms of energy saving initiatives, energy generation as well through deployment of on-site energy generators such as wind turbines, etc. And it also has a role in terms of carbon capture around wetland expansion and tree planting, and also flood alleviation and biodiversity. This is just a highlight from some outputs from the report. I'm conscious of time, but there's detail there in terms of each of the different recommendations. And I'll just finish with some things I think have been really key to the success of the Greenway. One is that community involvement right from the start. It's joint managed between the local authority and also a local social enterprise, which really, I think, has benefited from that community engagement. And it's very much there to support the local community in all sorts of ways. And I guess I leave with one thought from this work, is really that need for long-term commitment from research, policy, practice, to really realise that kind of full potential that these green and blue spaces can have, both for kind of public health and planetary health. So my timer's just gone. Happy to have a chat with anyone afterwards about this work. Thank you.